everyone, welcome to PHAMCAST. I'm Margaret Wallis Duffy, your host, and I am really super excited about today's show. And I gotta be honest, a little bit, I don't wanna say nervous, but a little bit of anxiety because I'm about to share something deeply personal that I haven't been this candid about in 43 years. So I'm going to give you a bit of my personal background and story. Many of you that have followed me for years, whether it's at Wallis for Wellness or whether it's online, know that I struggled with this chronic condition that I never really named. And the reason I didn't name that disease, this horrible thing that I went through, which I'm going to tell you about in a moment, was because I had been gaslit for almost 10 years from the healthcare community. Because here's the problem, I didn't look sick. And despite the efforts as a young girl and a competitive athlete, my parents took me from doctor to doctor to surgeon, and because I didn't look sick, I was labeled a hypersensitive only child, a drug-seeking teen, a competitive athlete with a nervous stomach. But I knew in my heart of hearts that something was seriously wrong with me. I was in excruciating pain and dying on the inside, but putting up a brave face on the outside because I'm an ambitious young girl that had hopes and dreams, just like all of you young women. And so what do? You keep pushing through. And after 10 years, I finally looked a doctor in the face, a specialist, and said, I'm not leaving this hospital until you tell me what's wrong with me. And after a diagnostic laparoscopy, I was diagnosed with severe endometriosis. It finally had a name. A name that for years I had been struggling with in excruciating pain that was hijacking my life, not allowing me to go to school, not having a proper job. It led to 10 surgeries, 4 bowel obstructions that required nasogastric tubes to rectify. I had a rare case of endometrial tissue on my lung that caused a lung collapse. It impacted my fertility, and therefore I had to go through infertility treatments. And I am blessed and grateful for my 2 children that are 6 years apart for that reason. And I went through menopause at the age of 39. This has been quite a journey. And just this summer, and it's the reason I started Wallis for Wellness, and it's been the launch pad for my whole career in preventative and integrative health, because I didn't want other people to go through what I went through. And here's what my journey taught me. That if it wasn't for allopathic medicine, because we need it, I wouldn't be speaking to you. But equally and as profoundly true, if it wasn't for complementary medicine, I wouldn't be speaking to you either. And that's why I started Wallis for Wellness 33 years ago, long before it was cool to even talk about this. To break down the silos in healthcare and bring both sides of the equation together, but with one mission in mind. To put the everyday person like you at the center of their care. To stock your toolbox with education so you can make more informed decisions and advocate for yourself and become the CEO of it. Well, when I sold my clinic 3 years ago and started the preventative health movement and this show, it was on that basis because I'm being called to change the legacy of healthcare in this country. So back to my story about endometriosis. Just this summer, in July of 2025, I was sitting in my home and happened to be reading an article on LinkedIn, and the tears started to stream, and I'll tell you why. Because I heard and read an article for the first time about a new diagnostic test for endometriosis that didn't require surgery, that wasn't invasive, but that would reduce the times of diagnosis from, on average in Canada, 8.6 years to under an hour without surgery. Tears were streaming down my face, and I knew it was a full circle moment and that I had to find a way to bring this test to Canada in a big way to as many women, so that women of all ages, young girls through to menopausal women, because yes, women, you can have endometriosis during menopause. I didn't know that. And so in came this tier 1 diagnostic test offered by Endodiagnosis, not the manufacturer, but the distributor. And the first call I made was to my good friend, my respected colleague, Dr. Kristy Prouse, who is the founder of the Institute for Hormonal Health. And she's with me in studio today because she knew my story. She's helped me through it. But when she saw this, I wanted her to look at the science. And we're going to share today what we've done since that fateful day in middle of July. Dr. Prouse, I just poured my heart out because I never named the disease endometriosis because people would just say, oh, it's a painful period. Oh, you're missing work or school again.
Yeah. Yeah.
You're a gynecologist and an obstetrical surgeon. You're now trained in functional medicine. My story's not atypical, is it?
No, unfortunately it's not. I mean, do you have an extreme of the story? Absolutely. But there's a lot of women that are struggling in silence, and as you say, it's often one that goes undiagnosed for an extended period of time. In fact, the average age to diagnosis is sitting at around the 8-year mark. Yeah, that's a long time to struggle.
And a long time struggling, but what also happened, which was in my case, and this is why we do this show and why you're now in functional medicine and looking at health span and prevention, if I'd got an earlier diagnosis, it could have changed not only my health, but my life. The things I missed, it impacted my university career. It impacted so many decisions in my life, my relationships, mental health, physical health, financial health, sexual health, all of it. How important is it to get an early diagnosis for many diseases, but certainly endometriosis?
Yeah, well, and you just touched on it. It's a whole system condition, right?
Yes.
It's not just painful periods.
Yeah,
absolutely, and it really does need to be recognized on a much broader scale. When you pick up pretty much on any disease in its early stages and you can have positive impact, it's preventing complications down the road. Everything from the fertility issues to ingrained pain patterns that the body starts interpreting a pain in a way that it didn't in the beginning, and it just becomes entrenched and exaggerated in many ways. So there's the obvious impacting on relationships and jobs and the pain, but it goes even deeper than that.
Yeah, so when we talk about endometriosis, which I always just thought it was a bad period, it is actually a neuromuscular immune disorder. Explain to people what endometriosis does. You know, your background in genetics and cellular biology, and as an OBGYN, explain to us what is endometriosis and how it can end up on my lung or someone's knee or their bowel, which cause bowel obstructions. Explain the physiology.
So endometriosis is when the endometrium, which is the lining of the uterus, ends up in a place outside of the uterus. And actually sometimes inside the walls of the uterus as well, which is also known as adenomyosis. It's a version of the same thing. But these endometrial implants can land outside of the uterine wall, and they are still responsive to our hormones, and estrogen in particular. And so when they're stimulated outside of where they're supposed to be, it can cause all sorts of problems because they're shedding in the same way and being stimulated in the same way. And so there's that sort of on a mechanical level, but these endometrial implants also give off prostaglandins, and very unique pattern of prostaglandins. And when those prostaglandins are released from the implants in quite actually significant volumes, they are transmitted through the circulatory system back through the enteric or the gut circulatory system, and can cause all sorts of havoc from a gut perspective as well. So when you capture everything, yes, you're dragging in the neurologic, the immune condition, the hormonal stimulation. This is part of what I mean by it's a systemic issue.
It sure is. So when we're talking about, when I saw this test, the EndoSure test, that is, let's talk about what the test does, how it is innovative and going to be a game changer for the future of women, and both from an early detection, but also from a management of endometriosis. Let's talk about what that test does, what the people can expect, because we just had an Endo Roadshow. So from July, it only took us a month, and we did a 3-city tour, an Endo Roadshow, with media that came along, and we were changing the lives of women. We were hugging women as they cried and got answers, whether they had endo or they didn't, because being validated and heard is so important, because how do you change, even with a differential diagnosis, if you think it's endo but maybe it isn't? Let's speak to that and what the actual test, what they can expect.
Yeah, so endometriosis is known as the great masquerader.
Yes.
Right, it can present in a way that a lot of other diseases do as well. So things like interstitial cystitis or irritable bowel syndrome, or there's other pain syndromes, pelvic floor dysfunction. So it mimics a lot
PCOS.
of PCOS. So having a tool that can distinguish between all of those and come up with an answer, a yes or no, in a non-invasive way is hugely important. It's a placement of 3 electrodes, much like an EKG, right? So it's not invasive in any way. You sit quietly over, in total about an hour, you get a reading, believe it or not, of your gastrointestinal tract.
Activity.
Exactly.
Yeah.
And so those prostaglandins that I was mentioning earlier that float around through the circulatory system and then through the enteric circulation are releasing those prostaglandins locally. And what that does is it creates basically a reverse peristalsis along with a peristalsis and results in this spasmodic contraction of the gut that shows up as a very distinctive fingerprint on these electrical output. And so again, it's a very easy way of distinguishing between other diseases, and at the same time, it's non-invasive. So in that way, it's a big game changer because historically, it's a surgical diagnosis.
Right. And you as a surgeon, and we've had this conversation personally, you're skilled at what you do, you're passionate about women's health, but you've even said to me, Margaret, I'm sure I've gone in and closed a woman after surgery and said, you're clear. Yeah. And you know that that may not be the case. And this has happened to me, where I knew I still had endometriosis in me. The surgeon said I didn't. Let's talk about that and why that happens, but how this is also a game changer with this because it shows activity level. So you can have this EndoSure test and then go back to the surgeon and say, well, you may not know, you don't think you see it, but go find it because it's in there somewhere. Talk about it from that lens.
Yeah, and I think it's important to know that it can be overlooked.
Yes.
I mean, yes, it can be overlooked because you miss it, and that's, can happen for sure. But I think it's also important to understand that an endometrial implant needs to multiply, that one cell needs to multiply to 1,000 times before it's visible to the naked eye. So if a surgeon goes in and takes a look, but an implant hasn't multiplied to 1,000 times, there's nothing to see. So in other words, you could have a pelvis full of endometriosis, but not be able to see it. Right. And so that's where this test can pick up, and it's a very, as I say, it's a very unique fingerprint to endometriosis. So you know it's there. It doesn't necessarily say that it's in the pelvis or it's in the lung or it's right.
Correct.
It could be elsewhere.
And that's
but
the other
there.
point. They may not recognize that endometriosis exists somewhere outside of that pelvic area, like it did with me in causing an atelectasis, a lung collapse. And I mean, I've heard thousands of stories over the years from women who are struggling, and I think that's really, really important. And what also is great about this test, the activity level of the endometriosis is good as well. So as a surgeon, that's helpful, is it not? With how you decide how you treat after.
Yes. So for example, I mean, sometimes people do come back with pelvic pain post-surgery.
Right.
And it can be very difficult to distinguish, is this endometriosis that wasn't dealt with, or is this
scar tissue?
Scar tissue, exactly. And so you can distinguish between the two of those, or for that matter, your medical management, right? And whether that's having the impact that you're looking for. I mean, obviously your patient knows because of symptoms and how they're feeling, but it does, in some instances, help you decide, what is the cause and is it really still endo?
And then what's the next step exactly? What do we need to do? I know one of the women on the tour that we did this time, she found out she doesn't have endo. And although disheartened because she was looking for answers, it was really important for her team of doctors to know, okay, that's crossed off the list.
Exactly.
Now what is this? What else is this?
Precisely. And I think that particular case, I know which one you're talking about, it had to be part of the differential. It was a very strange presentation with symptoms that were related to the menstrual cycle. And so, you had to consider, is it one of these unusual cases where endometriosis is elsewhere in the body? Because you couldn't ignore the timing of it all. She'd been worked up otherwise, but this was an important thing to cross off the list. We know that, no, this is not it, so let's not bark up a tree that we don't need to bark up.
And from the patient lens, I will say this, it's really empowering when you finally feel like not only you're being heard, but you're doing something to get answers. Even if it's a yes or a no, you've got an answer, and that's what's so powerful. Let's talk about the fact that my story, yes, I had symptoms from menarche, from my first period, but I didn't get a diagnosis till I was like 19 years old. So that 9 years, there was a lot of time for that disease to grow and expand. Let's speak to this test and how, especially for younger women, or even, women in menopause, you do a lot of work in hormonal health and menopausal women that they may think they're just struggling with menopause, but in fact, endometriosis could still be rearing its ugly head because there's something called silent endometriosis. You can have horrible disease, but not have the symptoms like I did. I had both. And so early detection or finding out earlier to prevent progression of disease, how important is that?
Yeah, I think it's very important. It really is like pretty much any other disease process. You don't wait for it to happen and manifest in its fullness. Ideally, you want to get on it in advance and take more of a proactive or a preventative measure to it manifesting in other ways, like infertility.
Yes, exactly. And also family, there's a bit of genetics and heredity in this disease. It's interesting because my mom, and I know she would be fine with me to share this, but there's a lot of research about women hemorrhaging after birth due to endometriosis. Well, my mom, who is 82, shout out to Mom, Mary, she had a horrible time giving birth to me, had horrible pain, and back then she was completely ignored. I was ignored as her daughter, and now generationally, my daughters are going to be tested because it can happen. And how cool is that to avoid catastrophic things after delivery as well, if we know in advance that a woman has endometriosis?
That's right, yeah, absolutely. And that is a little known fact even in the obstetric community too, that there is a connection there. But you think of globally and those that perhaps don't have the same access to care as we do in a developed country, how it can be a game changer and sort of manage where people are even delivered.
Right. Now, we can't talk about this topic because it's so full of anxiety and stress for women, and not talk about the now, what do we do? So when someone gets a diagnosis, I mean, I'm going to be candid, I've lived with it my whole adult life. There's no quick answer, but just like anything in health, having a diverse integrative health toolbox is critically important. And I can't think of a better person to talk to about this topic than you, hence why you're here today, because as a gynecologist, but also trained in functional medicine and hormones, there are different ways to look at this. Just very briefly, we're not going to go into all of it, but there's from the surgical management to the medical to integrative approaches, just a high overview to give women hope that once they get that diagnosis, we've got them. We can continue to help them be part of their story to change the way they're feeling and living better.
Yeah, and I think this is actually a really perfect example of where it is important to integrate all different modalities, and you never know what part of is going to be the biggest piece of your puzzle, right? And so it's one of those things where you're going to want to try what's going to work to make a difference for you. So yes, there are conventional therapies that can be very effective, everything from oral contraceptive pill to progestins to IUDs, etc. Surgical management, of course, is another important way of managing it. But then there's this whole foundational layer that can make a huge impact and can work hand in hand in conjunction with any other treatment. And I think if you look at endometriosis as an inflammatory condition,
indeed,
there's so much that can be done as far as dietary changes and lifestyle changes and supplements and all sorts of things that can do to reduce that inflammation.
Yes, and that's what Wallis for Wellness was all about. Finding things that helped me and then passing it over, not just to patients with endometriosis, but certainly from an inflammatory perspective, which is the base of all disease. Yeah, as you said, nutrition, movement, exercise, hormones, supplements. Something we both love to use, the Dolphin NeuroStim, which can downregulate the autonomic nervous system, reduce inflammatory markers, and drop cortisol in pain. There are so many things that conventional medicine, and this is no fault of theirs, you had both training, but they don't have that in their toolbox. And so if you're going to see your OBGYN or your family doctor, they're only going to have certain things in their toolbox. And there is a plethora of other things that you can add to help manage your symptoms of endometriosis, which is what we're excited to be doing. Not only bringing this new Health Canada authorized Tier 1 diagnostic test for endometriosis in under an hour with no surgery, you're going to get a diagnosis. But then we're going to help stock your toolbox with the now what do I do, whether it be helping to find referrals to different people for, whether it be their gynecologist, still needing good ultrasounds and those types of things. Everybody plays a role. But what we're excited about is to bring that all together to change the future. And for me, that's the full circle moment of my entire career. And I am so excited and honored to be linking arms with you. And it's taken 33 years to share my story so candidly like this, but now I get to change the lives of other women with endometriosis and hopefully let them have an amazing life like I have. That's taken a lot of hard work and struggle, and that's what I'm here for. So Dr. Prouse, thank you always for not just your knowledge and your willingness to give of that knowledge, but your heart, because at the end of the day, that is what your patients feel, and your willingness to always be on the cutting edge of science and understanding what to do to help people. I just want to personally thank you, because you were a big part of my puzzle, and now I get to help you be part of others.
Yeah, well, and thank you, because of course you are a go-getter that puts this on the map.
Thank you.